Hello, everyone. Welcome in, welcome in. Give everyone a couple seconds for that notification that we are live with our webinar here. See a lot of familiar faces. Thanks so much for joining us live. My name is Cassie Hopkins, and I help coordinate the webinars here at Houseman Group. We're so excited to be able to kick off 2026 with our benefits compliance update. You guys are very familiar with benefit compliance services if you've been around a while, and they really do such a wonderful job giving us really prevalent and timely information on compliance. Casey is going to go over a lot today, so I'm just going to do a couple housekeeping items and then we will kick it off without further ado. So the first thing to be said is this webinar is recorded. So if you want to share this with your colleagues or peers, if you want to return to this at any point in time, it will be available on our website as well as a copy of the slides. This is also certified for one SHRM and one HRCI CE credit, and that will be available in our follow-up email. And the last thing is we will be doing Q&A a little differently. After each section, Casey is just going to pause and we will allow everyone to get in any questions that they may have. If we have time, we'll do a formal Q&A at the end, but we just want to be available right after we discuss a lot of different things to see if there's any questions. So without further ado, let me introduce you to Casey Ripstein. Casey has over 20 years of experience in employee benefits, with 15 of those years focused on building a dedicated compliance practice for a large national brokerage. In his role, his leadership was central to scaling brokerage operations during periods of massive regulatory change. His knowledge of health and welfare compliance is among some of the best in the nation, but his greatest skill set is the knack for making difficult topics easy to understand and apply. He is licensed in life and health professional with CEBS, GBA, RHU, REBC, and CHHC designations, and HIPAA self-funded single payer and PPACA professional certifications. Thank you so much for being here, Casey. We love having you, and you can take it away.
All right, thank you. And I recently added another designation, got a flexible compensation specialist. I'm going to be working on becoming a 125 expert. So thank you for having me. Thank you all for joining us today. We have quite a bit of ground to cover, and the terrain is uneven. It's a little bit varied and disparate. So that's why we want to make sure as we go through each section with you today to kind of pause and see how you feel. See if you want to submit an inquiry on, hey, before we move on, can you clarify that for me? We'll start with HIPAA. This seems to be the year of HIPAA. Definitely going to have some major things going on in that space. And then, of course, ACA reporting is due in March. You've probably been working on that, probably wrapped it up, but we want to make sure you feel like everything is on point, that you are comfortable with what you were presented with, what you were supposed to do, and reviewed it for accuracy well. So we want to empower you with some tips and tricks there. OB3 had changes, one of which was for 2025, but a lot of which are for 2026. And here we are. And we got some guidance in early December on direct primary care specifically, interacting with HSAs. So we're going to spend a minute just kind of talking about what happens now that 2026 and those new changes are here. And then we've got things on the horizon to be looking at, including some big news in PBM reform at a federal level. I know all of us have been like, man, the states won't let up. They keep passing reforms on the PBM side, but now we're seeing it at a federal level. So we're going to talk about that at the end. So with that, we'll start with HIPAA. A couple of things that we're focused on this year with respect to HIPAA. One, we had this confusing idea that our HIPAA notice of privacy practices is supposed to be updated by February 16th, which is a holiday. And the government promised they would give us model language in an updated model notice of privacy practices. And we waited and we waited. And the focus of this new language is on additional rights and protections with substance use disorder records that our plan processes and operates with. We needed new disclosures of rights and responsibilities and redisclosure warnings, fundraising opt out, these kinds of things that you see at the bottom here. we waited and waited and waited for the model notice to come out, and we were like, what is going on? When is it going to come? It shouldn't be that hard. Yeah, they waited until 4 p.m. Eastern, the Friday before the Monday deadline, a Monday holiday deadline, to get that out. We did catch it, finally have that in our possession. It was pretty minimal changes, the kind of stuff they could have done months ago. So we now have the model. And it's important if you have a HIPAA notice of privacy practices that you give employees. We go ahead and start using the new model. If the model is what you use, let's update to the new model, put that out there. And just as a reminder, anytime you have a new HIPAA notice, including, hey, I'm retiring the old one and I'm adopting a new one, like we're doing for this, we need to get that out to all the current plan participants within 60 days, but go ahead and start providing the new one to your new participants as they enroll. And in a HIPAA space, this is not really in the ERISA context. So the electronic delivery rules that we have for all sorts of ERISA documents don't generally transfer over to HIPAA. So we generally want to be providing this on paper unless people have specifically consented to electronic delivery. So, you might see if people have been giving electronic consent, that is valid until they revoke it. And then you could just send an email letting everyone know it's out there and ready, or you might want to send it on paper or hand it out at work. But we now have the model notice, and hopefully that helps everyone. We had a stopgap where we had created our own little addendum to the previous model notice to kind of tide us over until we see what the government came out with. Yeah, the addendum we came out with had a lot more text than we ultimately got from the government. So apparently they thought it was no big deal, and it should be an easy accommodation for employers to just go ahead and adopt. Okay. If you got your notice of privacy practices from another source, maybe your benefits counsel or another source, you'll just want to work with them on getting it updated through them. Now that they can see where the government landed on language, they might have some ideas on how to help you with that. Okay. So that pertains to the update of the notice. We are also expecting big changes for cybersecurity rules, and this is a heavy lift. So, you might recall about a year ago in January, we got a proposed rule on some cybersecurity updates in HIPAA space that looked like it's going to be pretty extensive. There's going to be a lot to it. And as far as we can tell, the final rule that they intend to publish is on the docket. It's on the schedule to be published in May with a 120-day deadline to comply, which means you'll have until August to get all that stuff updated and implemented for yourself. So for an employer that has a fully insured plan integrating with a data analytics system, or maybe you have any kind of a self-insured arrangement, might be a health FSA, might be a health reimbursement arrangement or HRA, might be a self-insured medical, dental, or vision plan, a level funded plan. All these, bolt-ons and carve-outs that are not fully insured, so they're really self-insured. Anything you have that might be self-insured, along with fully insured integrated with data analytics, you really want to be paying attention to this stuff. You want to have robust protocols to protect protected health information. You want to protect access to it, the uses and disclosures of it, and have some rigid access controls and monitoring, robust backups and testing, and be documenting constantly throughout the year all the ways you're trying to punish and test the system to see if it can withstand brute force attacks and somebody trying to come in and log in incorrectly. Will it catch it? Will it shut things down? Will it, alert people? All these kinds of things. And they're really leaning towards saying, look, nothing is going to be quote unquote addressable anymore. Everything's going to be required that we talk about in these rules on a going forward basis. So that has been a little confusing. You had to address every rule, and some of them were called required and some of them addressable, but people mistook addressable for optional. They said that was never our intent. It means you have to clearly outline your processes and procedures for this addressable requirement, etc. So they're proposing that, hey, when we issue this final rule, everything's going to be required. So, for example, we're going to probably implement a requirement that anyone with access to a TPA's portal, Flex Administrator's portal, that kind of thing, claims analytics software, in addition to having login credentials, we're going to require multi-factor authentication. It's got to send a text, or you've got to go to an authenticator app, or use some biometrics of some kind. That will be a requirement. So that's the kind of stuff that they're talking about implementing for this summer. And employers with those types of plans will have to work on making sure to bolster their defenses in this area. So, bottom line is they have their eye on all the breaches happening with private protected health information. And they said, it's really time to make sure we have all the safeguards we possibly can to protect people's data. So those are the couple of HIPAA updates. If you have questions, please go ahead and put them in the Q&A channel here, and we'll get to those. I don't see any now, so I will go ahead and move on. But if you have a HIPAA question that you want to throw in there, you go ahead and do that. I know ACA reporting season hit a lot of employers already, and you're probably hopefully done reviewing your data, but I want to make sure everyone knew what applied to them. Applicable large employers for 2025 are those whose 2024 employment counts averaged 50 or more full-time equivalents. Now, sometimes the counting rules can be confusing, and it's not always understood. If I'm an employer with less than 50 people, I feel like I should be not an applicable large employer. That's not always the case. And so one thing we like to point out, employers in a controlled group or affiliated service group under the tax code actually have to combine their counts. And this is where there's high common ownership or control percentages that make them a family of companies, essentially. So sometimes you have an owner of the business that owns a completely unrelated business, but owns both of them 80% or more. And that makes it a controlled group. Affiliated service group works a little bit differently, but this is the type of stuff that affects retirement plan testing, just like it does on the benefit side. So it is something that employers should know and be aware of behind the scenes for a handful of things, a handful of requirements, almost all tax-based that come up. So if you're an applicable large employer, we would have had those 1095-C forms that we would have had to review for all our full-time people. Parts 1 and 2 are where all the employment and offer of coverage data is provided. Part 3 is completed for anyone that enrolled in your self-insured plan, which can include a level funded plan or an individual coverage HRA. So hopefully that is all making sense and you feel like you've got that down. If you're not an applicable large employer, you probably don't have a reporting obligation unless there was 1 or more months where you had a self-insured plan that can include a level funded plan or an individual coverage HRA. I will say if you were level funded, you might check with whether your carrier helped you get this done. Some carriers in the level funded space will do the 1095B and 1094B on behalf of a non-ALE. So you might not have anything to do, maybe just double check their work for you. But otherwise, if this is the employer's responsibility, you want to make sure it got done. You only report people that enrolled in your self-insured plan, and you only mark the months they were enrolled in that self-insured plan. So if you're a fully insured part of the year, self-insured part of the year, we're really only focused on the self-insured months. So that's the breakdown of what forms apply to which employers. The deadlines are in March. So early March, on March 2nd, we have the individual 1095 statements due to individuals. So these kind of function like a W-2. They're the ACA reporting version of that. You give that to employees by March 2nd, but we had some new relief last year to say if you're an employer that doesn't want to mail those out to everybody, Congress gave us a new law to say you don't necessarily have to, as long as you have some language on your main public website giving people instructions on how to request their 1095 form. So that's really good news. And this also is available to non-ALEs doing those 1095B forms for their self-insured plan. You can provide language, which we've highlighted on the right side here for you, on your main public website, instructing people how to request a copy of their 1095. And then you only have to give it to people that actually come and ask you for it. You give it within 30 days of their request. Leave that language up on your website from March 2nd through October 15th, and then you only have to provide these when people ask for them. The exception to that is New Jersey. For your New Jersey residents that you employ, I know a lot of you have remote employees. New Jersey didn't like that. They still want that to be proactively mailed to them. So those 1095 statements still need to be mailed or provided electronically if they have given electronic consent. Okay. The end of March is the deadline to get everything electronically filed to the IRS. So that's going to be these 1095 statements that we gave to individuals along with a 1094 cover sheet. So if we're an ALE, we do the C forms. If we're a non-ALE with a self-insured plan 1 or more months, we do the B forms. All of this gets e-filed to the IRS at the end of March. And they don't actually get any of the PDFs that you see or the dashboards your tech reporting partner might show you. What they are actually getting is called an XML file. That is what is e-filed to the IRS. It is worth asking your chosen tech reporting partner, hey, can I get a copy of my XML file too? I would love to have my own copy of what you're actually giving the IRS on my behalf. I know I audited my dashboard that you gave me or all the PDFs you showed me, and I audited all those for accuracy and I feel good, but I would really like to also see my XML file to understand what you physically actually sent in an e-file to the IRS for me. Definitely recommend you have that. You never know if you're going to be with that vendor long term, and trying to ask them for it after you have left them might be a problem. So we want to make sure you have that in your back pocket. Okay. Now, we talked about the importance of getting right whether you're an ALE, an applicable large employer under ACA rules. Really important we do this right because there isn't a carrier or a third party administrator that's going to do those 1095C and 1094C forms for us. When we're an employer of that size and that we trigger the C forms requirements, the carrier is not doing it. The TPA is not doing it. This really is the employer's responsibility, and we want to make sure that we understand it's something we're responsible for and that we got it done. So, if you have a question about whether you're an ALE in any given year, we do have a calculator that we provide that I would strongly recommend you just go ahead and complete and have it as documentation on file for yourself to just demonstrate. I did all the counting the way the IRS instructed, and I came up with a determination using IRS rules that I was not an ALE. I think that will bolster any statement of why you didn't submit C forms. This can be particularly helpful, for example, for groups with higher turnover. Maybe you have 100 W-2s you issue, and so the IRS comes in asking, why aren't you giving us C forms? You seem like a large employer to us. So really definitely strongly recommend if you're an employer that's not clearly over 50 full-time and equivalents, definitely engage your Houseman team to run through this calculator each year and keep it on file for yourself. Now, when you're auditing your C forms as an ALE, these 1095C forms, part two of those forms is where you report the offers of coverage you're making, whether they're affordable and minimum value. And there is some confusion sometimes on what code should I be seeing, especially when the reporting tech partner generally creates the codes for you. You may not understand if they're picking the right ones for you. You may just be assuming they would pick the right ones for you. It's really good for you to understand in pretty good depth why certain codes should apply and when a different code might apply. So I wanted to give the most common examples we see, and there's three of them here. I'm going to skip to this middle row. Most employers offer minimum value coverage to the whole family. Usually, if there's a spouse condition, it's a surcharge, if there is one. Every once in a while, we'll see an employer say, actually, spouses can't be on our plan if they have eligibility for coverage through their work. That's called a conditional offer, and you can see I've got in that middle row there, we use a 1K for those, but those are pretty rare. Most employers have a minimum value offer to the whole family, and spousal surcharges are fine in this scenario. So 1E is most often going to be the code we use to report we made an offer to our full-time employee. Okay, so 1E should be what you see most often in most employer situations, and a minimum value offer to the whole family for that whole month. When we use 1E or 1K in the conditional spouse offer situations, line 15 needs to show the cost of the single coverage for that employee for that month. That might be, 100 a month, 150 a month, whatever that number is for someone to have the lowest cost single minimum value plan with you. And then we jump to line 16 to explain what did they do with my offer. 2C is the code to use when they enroll. So that's usually one that's used quite a bit. If they waived our coverage, we really want to explain what affordability safe harbor we used. And if you don't know what your safe harbor is, we also have a calculator to help you with that. So you can always reach out to your Houseman team to understand, hey, I need documentation of exactly what safe harbor I'm using for affordability each year. And that can be provided for your documentation and you can go reference it. But generally speaking, the codes are 2F if they're waiving an offer that's W-2 affordable for that employee, 2G if they're waiving an offer that's FPL affordable for that employee, or one of the more common ones, 2H if they're waiving an offer that was rate of pay affordable to that employee. So these are very specific to that employee's offer, how much the lowest cost single plan cost them, and what safe harbor you're using to determine affordability for them or their class. Okay, so hopefully, if they're waiving, one of these applies. If for some reason you have some people you're not affordable on, and I see this, I do see employers pretty regularly be able to be affordable at, I don't know, 15 bucks an hour, but man, those people earning less than that, there's like six of them earning less than 15 bucks an hour, and I'm not going to be able to get affordable on that lowest cost single plan for everybody. I just need to focus on 15 an hour up. Okay, then if anyone under the $15 an hour waives your plan, you're going to leave line 16 blank, and those are potential penalty months. If that person went to the marketplace, bought coverage with a tax credit, you'll get a penalty letter a couple of years later on that specific person. Okay. Now that should be coding most employers see most of the time. 1E, the single cost, and 2C if they enrolled, an affordability code if they waived. It's pretty easy stuff. It's not too complicated. But when you have lots of employees, it becomes a lot of data to sift through. So one thing I do like to encourage for employers that are federal poverty line affordable, so FPL affordable, if you're mainland FPL affordable the whole calendar year, and spouses are eligible even if they work somewhere that gives them access to coverage, and the children are eligible to the end of the month they turn 26, this first row says that's actually what the IRS calls a qualifying offer, and we can check a box on our 1094C cover sheet to claim the qualifying offer method. What it's going to do is open up simplified reporting for us on the 1095C. What do I mean by that? Okay, so we already talked about how normally an offer is 1E, the cost in line 15, and 2C or an affordability code if they waived. And when we've got lots of employees, that's a lot of data to audit. Okay. Instead, if we qualify for this, FPL affordable all year, meet all the correct requirements, we can report those offers as 1A. We will leave line 15 blank, and we can leave line 16 blank if our reporting tech partner will let us. It is by definition already FPL affordable, therefore you don't need to indicate a 2C or a 2G. They already know those are the two answers. So you don't have to put a code there. Some vendors don't like that. That makes them uncomfortable. But I like this qualifying offer method because you could, if they would let you, just review the data put in line 14 for all your offers. and 15 and 16 would be blank for all those offer months. When you're talking dozens and dozens of employees, maybe even hundreds of employees, to look through the data and audit and double check, you're not worried about did they enroll or did they waive. You're not having to pay attention to any of that in line 16. You're just good. So it's so much easier to double check their work later if they will let you truly take advantage of this. If they insist on having a 2C or a 2G in line 16, it's not the end of the world. It's just depriving you of a big part of the relief. Now you got to make sure, well, did I indicate 2C on the people that enrolled and 2G on the people that waived? Or did I get any of those wrong? Actually use 2G on somebody that enrolled or 2C on somebody that waived. That would be wrong. So we would need to fix those. So this is a meaningful um, reporting relief method that employers could take advantage of and save you a lot of auditing time later, including if you do ask for that XML file and you go through it as well, it saves you auditing time on that. So saves you auditing time on your dashboard or PDFs you review, and then on the XML file if that's something you go review too. So very meaningful time saver for the employer that I strongly encourage employers to qualify for it. Take advantage of it. It works in your benefit. And then, of course, not everybody's eligible every single month. There's going to be months they don't work for you or they're in a waiting period. So 1H is the code that we use to say there is no offer for that month. We leave line 15 blank to say, hey, there is no single cost to report. They weren't eligible for anything. And then our codes in line 16 are really important now. So in this case, we need a code to demonstrate we didn't make an offer, but it was legit. Like I didn't have a full-time employee, I just failed to make an offer to. So 2A is the code to use. They were not employed any day of that month. 2B is they were part-time that month. 2D is they were in a waiting period that month. So those are the common ones I see. There is a 2E for multi-employer union. That doesn't come up very often. If for any reason a 1H has no code to use in line 16, that is a big penalty risk. And we don't want to see that hardly at all. I actually don't want to see that ever, but we really want to minimize how often that is happening and make sure it doesn't happen again in future years. So hopefully these coding examples help you kind of understand how to audit your forms for accuracy. And I definitely strongly encourage you, if you could take advantage of the qualifying offer method, it will save you a lot of double checking time. And then if you could take advantage of that posting to the a notice to your website to, hey, instructions on how to come and ask for a copy of the 1095, you'll save all that mailing time and postage and confusion. Like, what is this? Why are you sending me this? You won't have any of that. You'll just respond with the 1095 to those who ask for it. So some good relief there. Okay. And then, of course, request a copy of your XML file. I think that's just a good business practice because you just don't know if you'll be with that vendor long term for years and years and years. And if there's a question about a prior year submission, it would be best for you to have that on file. Okay. So I'm not seeing any ACA reporting questions in the Q&A, so feel free to send those in. Let's focus on the new year. We had ACA affordability update for the federal poverty line that we were just talking about. If you want to be FPL affordable or can be FPL affordable, these are the metrics that you aim for the lowest cost single plan to not exceed. So employees for a calendar year 2026 plan, if you want to be a FPL affordable, the lowest cost single plan providing minimum value would cost that employee no more than $129.89 a month. For a non-calendar year plan starting in 2026, that number is $132.46 a month. So if you can be FPL affordable, you can take advantage of all the great relief we talked about and save yourself a lot of auditing time. Also, bonus, this disqualifies people from applying for a tax credit to begin with in the marketplace. When you're FPL affordable, they literally stop their application for a tax credit and say, you can't apply. You need to be on your employer's plan. So, as you know, those tax credits are what trigger penalties to employers. Okay. There is a question whether HRIS vendor or an ACA reporting tech partner is required to give the employer their XML file if they ask for it. I'm not aware of a requirement. However, remember, these are the employer's tax forms that they're attesting to under penalties of perjury. So I would think the employer would demand, I want you to share my XML file with me because I am attesting to the accuracy of that file on behalf of my company under penalties of perjury. When you present that to them, I don't see why they would withhold that from you. Okay. All right. So with ACA reporting kind of like hopefully underway or done, and we're really focused on March distribution requirements. There are some other things in Q1 that we don't want to lose sight of. Okay. In January timeframe, which I know is past, but some of the things that we would have talked about are there any recounts we need to do? COBRA and Medicare secondary payer have some recounts you do every year. If you're not quite at 20 and you're hovering around 20, we go and do a very specific count to see effective January 1, does either of these laws apply to you all of a sudden, even if you don't have a calendar plan year. Okay, you might have a July plan year, but this stuff could be triggered 1/1 to you because of your prior year size. Okay, so there's very specific counting rules that we would do at 20, 50, and 100 for different laws to determine whether they apply or not. So I give some links here to get some basic understanding, but I think at the end of the day, if you're an employer hovering around that 20 or 50 or 100 mark, and you really want to understand if you have triggered any of these, work with your Houseman team to make sure you have the counts done right, and you understand what applies to you because the stuff tends to apply 1/1 no matter your plan year. All right, so we don't want to miss these. Some of them involve us as the employer staying on top of the count and notifying our carrier, oh, we just went from being under to over, or we went from being over to under. And we want to make sure to be in constant communication with our carrier partner. Okay, so these are the different counts that we want to be sure of. And then in February, which we're all in now, the W-2s would have been due February 2nd. I do like to mention that if you had 250 or more W-2s in last year, so in 2025, then the W-2s you just did in 2026 should have had the value of health coverage on them in box 14 using code DD. And there's a table I link you to here. The IRS gives a helpful table of exactly what has to be included in that value. It's both employer and employee dollars most of the time. There's other W-2 things, regardless of size. There could be imputed income, dependent care assistance program reimbursements that were given to that employee that year, HSA contributions. There's all sorts of other things that go on the W-2 as well, regardless of size. So we never want to lose sight of, hey, there's some benefit elements, some benefit tie-in to the W-2. Then I have a little starburst here for calendar year plans are why I'm focusing on presenting these in this late February, early March timeline. But if you're not a calendar year plan, we'll adjust accordingly based on your plan year. One thing that applies is after you renew, you're supposed to tell the Centers for Medicare and Medicaid Services, or CMS, I just renewed and my prescription drug coverage is creditable or not creditable or a mix of creditable and non-creditable plans. Okay, so you would need to know during open enrollment and be providing employees a notice during open enrollment whether your plans are all creditable or maybe one of them isn't, all that kind of stuff. Then when it comes time that, hey, the renewal has come and we've just renewed, we need to tell CMS on a portal that they have for us, hey, we just renewed and here's our status on creditable, non-creditable, or mix of both. Here's the date we provided materials in open enrollment, all that good stuff, okay? They want this to be done each year. They want it within 60 days unless you had a change in creditability, in which case they want it within 30 days. I would just tell you it's a 5-minute thing. It is not hard to do. I would just do it as soon as you renew and get it done with. It's super duper easy to do. There is no template to download. There's not a portal to log in like other things with CMS require logging into the HIOS web system and stuff. You don't have to do any of that. It's literally just a web form that asks some survey questions and you hit submit. For that reason, though, it is really easy and easy to get done, but that means it's not a portal you can go log into and see, did I do that? So when you do it and you hit submit, make sure it either sends you a confirmation or you take a screenshot of your confirmation that you did it so you don't wonder if you did it and you've got some documentation for yourself. Okay? So 60 days if nothing changed, within 30 days if creditability changed. In early March, if you have a multiple employer welfare arrangement or a MIWA, there's an annual reporting requirement called an M1 that's due each year by March 1st. Now, this is for employers that are they're sharing a plan with other employers, but they're not in a controlled group. So they don't have that 80% or more common ownership or control to really be sharing a plan together. They're under the 80% threshold. And so that creates a MIWA. And so you want to work with your Houseman team anytime you have such an arrangement to make sure you kind of understand what you have and what reporting obligations you have. You might have an M1 filing obligation. It depends. Okay, there's rules around that. So it's very important your team knows. Okay, ACA reporting, we just spent a lot of time talking about. And I did see a couple of questions come in on ACA reporting now that you had a minute to think about those. So let's go ahead and address those real quick while we're on the ACA reporting topic. Is the 1095-C reporting code per actual month, or is it over a look back? Meaning, will the code be applicable for a particular month that appears on the 1095, or will the code automatically carry over through all months of look back, an employer using the look back method? So basically, the code you're going to be reporting for every single month is the offer you made for that specific month. And it has to be an offer that was available for every day of the month. For employees in a full-time position or a full-time stability period, they're eligible that whole time. The offer is the same the whole time. The only reason something might change is in line 15, you might change the cost, right? Maybe January through June, the cost is 120, and then July through December, you increased it to 130. So you see, 1E across the board, but then 120 for 6 months and then 130 for 6 months. And then if they enrolled the whole year, you'll see 2C all year. If they waived all year, you'll see 2H if they were ready to pay affordable, that kind of thing. So usually it's the code that is reflecting what you offered them for that specific month. Where the look back method comes in is determining, hey, regardless of the hours this employee worked or was paid for this month, they're full time. We did a look back measurement that determined the average full time hours over a certain period of time. And that because they averaged full time hours over that look back, we are now determining their full time for this future period, a stability period, regardless of their hours. So that means we owe them an offer of coverage for all these months. And if there's a month we fail, that's a month that we have to report them as being full time without an offer. So you should have offers for all of those full time months, including full time stability period months. So hopefully that helps kind of explain how that works. For 2025 taxes in the 1095-C, will individuals not be mailed their tax form? Will employers be given instructions so individuals know how to access those documents? So a lot of the carriers are probably putting notification on their public website that if people want their 1095 form, this is how they ask for them from the carrier. So that'll be the 1095-B. And they're probably not going to proactively send them out unless they have to. Most of the carriers are trying to cut costs anywhere they can, and if they don't have to send them unless somebody asks for it, they're probably going to take advantage of that relief. Employers can do the same. That's up to you. You could have the language on your public website saying, I'm not going to proactively send these anymore. If you want a copy for yourself, this is how you ask for it, and you can take advantage of that. Most of the time, the 1095 is not needed for tax purposes anymore. There's a handful of states that have an individual mandate where that information is used, but for the most part, it's not typically needed. So not a lot of people come back and ask for the 1095. So hopefully that helps. Okay. So also happening in actually now in February, I have it as early March, but I've been hearing some reports that carriers are starting to reach out a lot earlier than early March with some questions for you, employers out there, about hey, there's this RxDC reporting requirement I'm going to do for you by June 1st. I need a couple of pieces of information from you in order to submit that. Okay. So what they're looking for from the employer is for last calendar year, how much did the employer pay and how much did the people pay for that calendar year of medical coverage? That's what they need to know. They know how much was paid in total. They know the total invoice amount for the calendar year of coverage. They need to know the breakdown of, well, how much did you pay and how much did people pay? And remember, people pay can include COBRA, retirees, things like that. So that number might be something you have to go dig up and run some reports to figure out. And then the employer contribution, they also need to know. So I strongly encourage employers gather those two numbers in advance for last calendar year medical coverage, regardless of what your plan year is. For last calendar year medical coverage, how much did the people pay? How much did the employer pay? Gather those two numbers. When this survey comes from your carrier or your third party administrator, you'll be ready to answer it promptly. They do have a firm internal deadline for employers to respond by in order to include your response in their filing for you. They are still going to do a filing for you if you don't respond, but it's going to be missing those two fields that you didn't give them in time. And then the employer that missed that deadline with the carrier is going to be responsible to report that missing data, those two missing fields, to CMS themselves. This one does have a HIOS portal to log into. This one does have spreadsheets to download, templates to complete that aren't always intuitive to kind of understand and think through. They're not complicated, but they're not intuitive. And so you kind of need a walkthrough, which we have, but I think the moral of the story is try really hard not to miss that carrier survey deadline, and then they'll just include those two data elements in the filing that they do for you. And then you won't have anything to catch up on and go fill in with CMS yourself later. Um, Try to have an idea each year of when they're going to send the survey and have a response deadline by, and then you won't be wondering, hey, how come I haven't heard? You'll know if a deadline has come and gone. Um, you'll know that, hey, I need to reach out and make sure I reach out to them before the submission deadline is over. Okay. Um, Also good to request or run preliminary non-discrimination testing. Usually if you have a flex plan in the mix, you have a flex administrator that can do non-discrimination testing for you. And the important one to run on a preliminary basis is your dependent care assistance program. That DCAP has a particular test that causes a lot of trouble for employers. It's a 55% average benefit test. And as you know, DCAP increased to $7,500 this year. If you took advantage of that, that 55% average benefit test could theoretically be even harder to pass than ever. And this is one that continually trips employers up. So definitely recommend running preliminary testing at least on your DCAP early in the year. This is a calendar year test most often, and so you want to run it maybe late March, 1st of April kind of thing. Okay. And then you can see I've got the starburst again, your calendar year plans. This is about the time, about 90 days after your renewal. You really want to make sure anyone that newly enrolled at open enrollment is getting a copy of all your plan materials, your certificates from your carriers, your SPD, as we call it, a summary plan description, all this stuff that formalizes your plan and explains in detail how it works, what it covers, what it doesn't, how to file an appeal. This is all really important language to give your people. You want to do an audit of, hey, is there anything I need to update for the new year? Go ask your carrier, go ask your TPA, look at your own RAP, SPD, figure out if everything's up to date, and get all this stuff out to people within the first 3 months of your new plan year. So this is the time to do that. If you don't have a calendar year plan, don't worry about the March reference here. Just adjust accordingly. About 3 months after your renewal is when you want to focus on having that done and out to people. Okay. All right. I think their question here about will all carriers request this. I'm thinking that's related to the RxDC surveys. Yes. So the breakdown of how much did the people pay and how much did the employer pay for last calendar year medical and Rx coverage is a required, those are two required data fields. The carrier does not have that breakdown. They do not have it. So they have to ask you for it, and they cannot submit inaccurate information. They would either leave those fields blank or ask you what those field answers should be. So yes, they should always ask you what those numbers are in order to have a complete filing for you. Okay. All right. Now you all know OB3 kind of changed a lot of things for mostly 2026. Um, there was a little bit of a HSA fix with telehealth back to the start of 2025, and that's a permanent fix. So HSAs can have low or no copays for telehealth, and that's all the way back to the start of 2025. But the rest of it was 2026 stuff. Mainly, HSAs can now be partnered with direct primary care. DPC used to be disqualifying for staying in an HSA and contributing to an HSA. No longer. Starting in 2026, we can have a DPC if it meets certain conditions. So we got some guidance in early December, I think December 9th timeframe, kind of talking about what some of that guidance needs to say. So for one, they said, as you know from the law, it has to be primary care, not other types of care. And they gave examples of things that should not be in the mix, like any service requiring general anesthesia is not primary care. So that kind of stuff, okay, can't be dispensing prescriptions. That's not going to be primary care. And cost no more than 150 a month or double for a family. They specifically said in the guidance that 150 a month or twice for a family, which will index in future years, does not have to be a monthly fee. So a DPC that charges for the year, charges for the quarter, those are fine. As long as the amount for the year or for the quarter doesn't exceed the equivalent of the 150 or 300. Okay. So that was good news to have that clarity. DPC cannot be part of your high deductible health plan, and it cannot. The fees you pay cannot count toward the deductible. So that is a line they drew in the sand to say this has to be something the employee's doing on their own outside of the plan. We will allow it if it's not part of your plan, and it cannot be an expense that they count toward the deductible. So that was clarifying guidance. Then, about three bullets later, three Q&As later, they said, by the way, a DPC that the employer sponsors or pays for or allows employees to pay pre-tax for, that's not taxable, but the employee can't then reimburse themselves from the HSA for it because it's already been handled on a tax favored basis through the employer somehow. Without explaining, well, does that mean me as an employer can sponsor a DPC or pay for a DPC or let people pay pre-tax for a DPC? It seems to be some like inherent permission that would be conceivable and be okay. But you just told me three Q&As before this, it can't be part of my high deductible health plan. So we're just struggling a little bit with how to resolve all that. And we specifically asked them after they published that guidance on December 9th, hey, can you please clarify how an employer gets in the mix on this DPC stuff? We want to make sure we're not violating any rules. We don't want our people to lose HSA eligibility. Let's make sure we understand exactly how we can do those things that you seem to indicate are okay. We need some clarifying guidance on how. How do you want us to set those up? So hopefully more to come on that. We already talked about the DCAP has a new $7,500 limit that started this year. That is half for married filing separately, so the 2,500 went to 3,750. And like we said, watch out for the non-discrimination testing. You want to be careful with that. Okay. There were also updates to some tax credits for paid family and medical leave that was supposed to sunset at the end of 25. They extended it permanently and tried to sweeten the pot a little bit for making it more attractive to employers. And employer provided child care tax credits soared under the law. They're monumentally different from what they were. So if that interests you, you can go check that out. Education assistance programs can permanently include student loans in the 5250. That was supposed to sunset at the end of 25, allowing student loans. That's permanent now. And they said, hey, starting in 2027, the 5,250 annual limit is going to start indexing each year. That's been locked at 5250 for a long time. One other thing that we wanted to point out is mental health parity seems to be a confusing topic for most employers. Um, there was a September 2024 final rule that ultimately got paused. So the updates made in September of 24 were put on pause. That did not put all of mental health parity on pause. And there seems to be a misunderstanding out there that it just made mental health parity go away. We have had mental health parity for over a decade, okay, a long time. It even goes back 20 plus years. So there is still a requirement for each employer to have on file for themselves, for their plan, a comparative analysis demonstrating parity with financial limits, quantitative treatment limits or QTLs, and non-quantitative treatment limits or NQTLs. So there's three comparative analyses that should be done on behalf of your plan each year. Only the carrier can really do that for you, or the third-party administrator if you're self-insured. We rely on them heavily to do this kind of an analysis for us. Really important we keep asking for that and getting a copy on file. Every employer was supposed to have one of these no later than February of 2021. So it is now February of 2026. This is a 5-year-old requirement. We really want to make sure every employer has what they need on file. All right. You've probably heard and seen the news that PBM reforms are here at a federal level. So we've seen a lot of activity in the states the last few years. At a federal level, we have a couple of big things. There's a new law effective 30 months from now, so around August 2028 or after, that's going to say there's very new detailed reports going to be required for the PBM to give all large employers, that's 100 plus, regardless of ERISA status, so even your governmental and church plans should be getting these reports. There's going to be new PBM notices and summaries for employers of any size. So we're going to have a new notice that has, by the way, a $10,000 per day penalty for failing to give it. So it is not one we're going to want to miss. We're going to be keeping our eye out for a model notice when it comes out and make sure it's integrated into your plan materials. And then the new law requires in 30 months from now that all non-transparent compensation, think PBM rebates, think spread pricing, copay clawbacks, you name it, all such non-transparent compensation is going to be required to be passed through for all size employers under ERISA. So governmental and church plans don't sit in this space, but all size employers with ERISA plans will have required contracts, must do a pass through of rebates and spread pricing and copay clawbacks and all those kinds of things. Okay. So that's coming in late 2028. Maybe for calendar year plans, that'll be January of 29. We'll keep an eye out. The government has about 18 months to publish regulations, so we'll keep an eye out for what that means. But changes are coming. Now, I will just tell you guys, the PBMs don't appear to be scared about this at all. They feel like they're going to figure out ways to still get their money, so they're not feeling threatened or worried about this in any way that I can see in the news. So I think this is really just kind of an empowering employers with the right data to understand what is the plan paying in claims and what is the plan paying in compensation at a deeper level so that you can be a proper fiduciary of your plan. You can actually evaluate it for reasonableness. Okay. There was also a proposed rule just a few days before this law passed They're intending for this to be finalized to start applying to plan year starting this July. And this is going to say that all self-insured or level funded ERISA plans in the country are going to have to start getting a PBM compensation disclosure before each contract year or agreement begins, each plan year begins, and then a semi-annual, so after 6 months into the plan year, you're gonna have to get a semi-annual true-up report that explains anytime the PBM made more than 5% over what they estimated when they gave you their initial estimates. So that is supposed to come this summer for all size ERISA plans that are self-insured, and that does include level funded. Um, and so that should empower employers with getting more information about how much PBMs are making. And then we did see Trump RX launch. It looks like it's mostly focused on coupons, like GoodRx type coupons right now. More to come on that. It's not a largely influential marketplace right now in the benefit plan space for for employer benefit plans. What it does help with is for people that have a drug that's not covered by their plan. Okay, one more thing. We had some voluntary plan fiduciary lawsuits right before Christmas. Just wanted to briefly touch on those. You may have heard of these. Um, Several employers and their brokers were sued because these voluntary accident, voluntary critical illness, voluntary cancer type policies that people pay 100% of the premiums for, um, there was a sense that they are paying very little toward claims. You know, 25 to 35% is going towards claims. Commissions are often as high as 40%. And these employers sponsoring these things, think United Airlines and some other big names you can recognize, um, are not paying attention and working to make sure these plans are structured in the best interest of the participants. These participants are overpaying, is basically what they were alleging. So, more to come on that. That was just filed right around the holidays. We'll see where it goes. We had a lot of fiduciary lawsuits against employers last year that ultimately all got dismissed for lack of being able to prove injury or lack of standing, those kinds of things. So this is something that has really run its course in the retirement plan space and is starting to take some traction in the benefit space, but not really land much yet. So we'll be keeping an eye on this, but long story short, if an employer has one of these types of plans, accident, cancer, critical illness, hospital indemnity, these kinds of things, where the employees pay 100%, the employer is going to be finding that those plans are subject to ERISA unless they are as hands off as you can imagine. Okay. The employer would have to not be the one choosing the carrier, not be paying toward it at all, not be letting people pay pre-tax toward it. The employer should not be getting paid for it. There should just be so little to no involvement. It should not be reflected in benefit materials, on a benefit portal, intranet, anything. Okay, so we want to make sure that the employer stays completely hands off if they don't want it to be ERISA plans. Most employers don't reach those metrics. They include it in materials and do some of the things that trigger it becoming an ERISA plan. And so fiduciary duties apply. You really do want to make sure you're monitoring your service providers for reasonableness in how the plan is structured and priced, and reasonableness and compensation. So that's the takeaway, is that applies no matter what type of plan we're offering. If it's an ERISA plan, we're a fiduciary of it. We ought to have some oversight of it to make sure it's covering what we intended. Members are not running into lots of red tape and denials and overpaying, and there's not unreasonable compensation or conflicts of interest in that compensation arrangement. So those are kind of the boilerplate type stuff that fiduciaries really ought to be paying attention to on a regular basis with all their plans. So with that, we'll take any questions to close out here. We got like a minute and a half or so.
All right, it looks like there are no questions at this time. If you think of something after the webinar and, oh, looks like we did get a question. Oh, thank you. You're welcome. Much appreciated. We appreciate the thanks. If you think of a question after this webinar and you would like to send it into Casey, I'm going to include his contact information in the follow-up email. That's also going to have the CE credits. It'll have a link to the recording of this webinar, as well as a copy of the presentation slides. So without further ado, thank you so much, Casey, for being here, for giving us so much information. It looks like there's a lot coming up down to the pike 2026. So we'll probably have more compliance updates to come in this year. So keep an eye out for it in your email if we're going to be doing another one later in the year. And then also please fill out our survey. We really appreciate hearing from you guys on what you think of these webinars, and it helps us get new ideas, fresh ideas. So thank you very much. Hope you have a wonderful rest of your day. And again, thank you so much, Casey.
Yeah, have a great day.